now,
for anyone who
or even $50 conference, but then
can.
you get hotel and travel.
Hey, Tony,
Yes,
but that's
there's
something like
someone talking in the
look at that,
background
see
that
which
we can
ones you
hear.
like. What? I just asked too. I was talking to her and I was like, I wonder if this thing's on right here.
it is on.
Okay, well, we're talking about conferences if you guys are interested. So,
Yes, that is one thing about just having these microphones that sit on the table is people are having conversations and they forget that everyone online can also hear those conversations.
luckily we were professional, so.
Luckily it was professional. So, I think that we are good. Everyone's here. So we will start out by going around and introducing ourselves, where you're from, and if you have anything that you need to share about your organization that has going on or upcoming, I'd love for you to share that. So we'll start with online this time. Amanda.
Good morning. Amanda Depew here with Illinois Joining Forces. I cover the southern region, so Effingham County all the way down to Cairo. We work with service members, veterans, and their families, connecting them to resources, and connecting resources to those same people. So thanks for having me.
Thank you for being here, Amanda. And next month, Amanda has agreed to be our guest speaker, which I am super excited about that because we haven't had much in the way of veteran presentation. So we're all looking very forward to that. Liesl.
Liesl Wingert, SIU School of Medicine, Center for Rural Health and Social Service Development. I'm the program coordinator for the eastern side of the state. And 95% of my work, if not more, is in addiction and recovery services, helping connect the dots for folks and expand resources across the region. Probably my biggest area of specialization is drug endangered children and family sex trafficking as it relates to illegal drug use. And yeah, that's what I do.
Thank you for being here, Liesl. Liesl is a wealth of knowledge. She's been very helpful. Yes, she is. She is. And from all the way up in Region 4, where I'm the new TA, I was just bragging about all the amazing people that are up in Region 4 and all the people that I have gotten to work with. Elise, will you introduce yourself?
Sure. My name is Elise Schoen. I am one of the managers over at St. Francis Way Clinic in Litchfield, Illinois. Work for Macoupin County Public Health Department, but as Tony was saying, I'm also one of the ROSC coordinators for Macoupin and Montgomery County ROSC.
And Sandy.
Hi, I'm Sandy Lorette at Kaskaskia College, right down the road. We have a dispatcher training coming up in June and July. If anyone's interested, it's Tuesday and Thursday nights from like 6 to 9, but it's a great opportunity. And last night up in Kankakee that would help people over the phone keep their lives skewed.
Thank you so much, Sandy. Sandy is also a wealth of knowledge and information, and they do so many more things up there than just sign people up for college. She's got some great programs going on up there. Mark, will you introduce yourself?
Good morning, everyone. My name is Mark Knott. I am with Metro Waste Recovery Council. I'm down here, same thing. Well, not the same thing, only part of what Tony's doing down here in Madison County. And thank you for having me, Tony. It's always good to see your face.
Always good to see you, Mark. Jessica Palazzolo is on and listening today, but she is unable to turn her camera or microphone on. So she is just listening in. She is from Lincoln Prairie Counseling Center. I am not going to say a lot about that. It is an adolescent facility that does mental health. What are you doing now? Where are you working at, Lauren?
I am not working anywhere right now. Yeah.
All right.
Finished with Recovery Corps, so.
Oh, what a wonderful program that everybody really knows Corps does.
Mm-hmm. Yeah,
So,
for sure.
that would be wonderful.
Yeah, I'd love that.
Awesome. Thank you. Jen Nagel.
Hey everybody, Jen Nagelfisher. My pronouns are they and she, and I'm the founder and executive director of the Porchlight Collective. We are a grassroots mobile-only harm reduction initiative, and we serve pretty much anywhere and everywhere that needs it, for the most part, in the greater St. Louis Metro East on the Illinois side. Yeah, happy to be here and really happy to see your face again in this or leading this meeting. It's always good to see you, and I thought that the last meeting that I attended would be the last that I would see you in this capacity. So it's very good to see you again.
Thank you, Jen. And I will continue to introduce myself every month, as this will be the last month I'm leading this meeting, but I don't know how many months that'll go on for. We'll see. Tracy. Right, Tracy may be tied up. Sheridan?
Hey there, I'm Sheridan with Take Action Coalition of Clayton County. My camera isn't doing very good right now, so I'm off camera. But did you have anything else we needed to introduce?
No, just if you have anything going on down in Clinton County that you want people to know about.
We are well, let me think. So we're working on Child Abuse Prevention Month in Clinton County. So we're just doing a small thing to raise awareness by putting ribbons out into the community for people to wear. And I've contacted schools and stuff like that. So working on it, small progress, but we're getting there. That's all.
Awesome. Good stuff, Sheridan. Sean.
Hey Sheridan, everybody. I just actually just talked to Sheridan. This is Nadine at Bond County Health Department. Sorry, I'm under Sean. I don't know why it always happens that way. I think I'm under his account, so.
I thought it was you, Nadine.
So I apologize for that. But no, thank you so much for having me. This is my first meeting with you guys, and I spoke with Tony, Dusty, a couple yesterday. Spoke with a lot of people, and we started this new grant. I'm not going to talk too much about it right now because I don't want to take up anybody's time with this, and this isn't really my area to do that, but I really appreciate you guys having me here, and I'll probably put some information in the chat if that's okay regarding this grant. I don't know if that's okay.
Absolutely.
Okay, perfect. I will do that just so I don't waste anybody's time. So thank you for having me.
That's okay. If we have a little bit of time at the end, Nadine, I'm going to give it to you.
Okay, I appreciate that. Thank you.
Yes, because I'm anxious to hear about it. So.
Okay, perfect. Thank you.
Yep. And Shani.
Good morning. My name's Shani Evans. I am with several projects at Chestnut, including the local ROSC. So I oversee the Madison, Bond, St. Clair, and Madison County. Did I mean Clinton County ROSC projects? Happy to be here this morning.
I love it. Shani is like me, moving positions gradually. We're doing a little shifting at Chestnut, and like when one shifts, another shifts, and another shifts, and so she also is kind of covering 1.5 things right now. But we're all loving it, and everything's good. And Shani has been a great help to me in transitioning into my new position while mission. So thank you very much.
I appreciate you taking so much on.
Well, I appreciate you and all the help you've given. So, Angela.
Angela,
Sam, you want to introduce yourself?
Samantha Hill. I'm from the Bond County.
No worries, you didn't really forget about me.
Some great work there. Do some very great work. Thank you for all you do, Don.
Systems. I distribute the naloxone.
Specialist with Fifth Street Renaissance.
Peer support.
And I'm Tony Randall. I am the statewide coordinator for Region 4 and the Bond County Recovery Council coordinators for currently. And we have so much knowledge in this meeting today. I mean, it is like just amazing, all the knowledge that is here. I think we could, change the world. Met her. And today we have Carrie McKenzie. She is the professional relations manager for the Southern and Central Illinois region of Gateway Foundation. And they do so much good work at Gateway. I have asked her, and I'm going to turn my screen so that she's on screen and not me. But I've asked her to share some of the things that they have going on, some of the work that they do, and some of the ways that they can help us in our work, and we can support them in their work. So, Carrie, there you go, dear. You take it away.
All right. Thank you. I'm going to pass around 2 flyers. Sorry for those that are not with us today. I will send it to Tony, and she can attach it in a email at the end with maybe our notes or whatever.
Absolutely.
So I'm sure everyone knows Gateway Foundation. We've been around for 55 years. We've helped over 1 million lives, and I actually came back to work for Gateway after taking about 9 years off, and we've added a few new locations. We've added some new services. So I'm sure everyone knows that our base standard is that we've been treating inpatient substance abuse treatment for around 55 years. We have 2 divisions. We have a corrections division, just to give you a little history, and we have a community division. And I work in the community division, and I, of course, we all reside in Illinois, but Gateway is also in 9 different states, embedded in the corrections division, which is really great. And we are the preferred provider for substance use treatment in those corrections. One being at our neighboring state, Missouri, which we are blessed that we can actually serve Missouri residents down at our downtown location. They have no funding, and they can have Missouri Medicaid. So we have opened up that new platform outside of being in, I couldn't tell you how many corrections facilities we're in Missouri, but it's a lot. I would say over 15-ish. So that's a new service that I get to actually go over in St. Louis and talk about. It's one of my new hats that I wear. So it is kind of confusing though for those clients that do go to our St. Louis location. We cannot take Illinois Medicaid there. So it's literally just for residents of Missouri, but it is a new service. So let's talk about our community division. Our community division has 16 locations in the state of Illinois. Most all are known for our inpatient substance abuse programming. Our Springfield location is our largest location. We have 108 beds there, with a full medical detox. So someone with a substance use disorder, with alcohol or opiates, even methamphetamine, can come into our facility in Springfield, and we can make them feel comfortable. We are not a hospital, but we have staff on site 24/7 that can help with medication assisted if they are just not feeling great. So that is one highlight from our Springfield location. And then if they are going to stay into our inpatient model, that runs anywhere from, depending on what funding you have, whether it's Medicaid, a grant, or which is free treatment, or commercial insurance. The payer sources pay anywhere from sometimes 25, I've seen at the low, to up to 35, sometimes 40 days for that residential inpatient model. I'll stop right there and let you know that we take all payer sources as far as your Medicaid and commercial insurances. There's a few that we're not in network with, and that is unfortunately HealthLink, which is what I have. My husband is employed through the state of Illinois. But again, we can work around some of those, and I work really closely with other treatment facilities that we can definitely take care of that. Veterans are always case by case, depending on if it's TRICARE or community care. And then those with Medicaid, we take all MCOs and all Medicaid. That's an easy peasy for us. We've been doing that for a long time. What we run into is we might have a little bit longer of a wait to get into our facility, but I know the workabouts with that. So I would be your contact, and I can get somebody approved and in treatment for 3 to 5 days at the longest. I know the ins and outs of not just our Springfield, but our Caseyville and our Carbondale location. And then we also have a full continuum of care. So that means that if someone is in the Springfield area and they want to stay involved in Gateway, they can do our outpatient programming. Most of our clients do not live around Springfield. They just go to whatever bed they can get to the fastest. So we will work with that individual and just see what they're looking for. If they're like, I don't want to go to Springfield, I've already been to Springfield, I want to go to Carbondale, then I will work with them to get assessed to go to Carbondale. I did not touch on, but we do, if someone does not have, say they lost their job, they had commercial insurance and they have not signed up for Medicaid, we will help them get set up with signing up for Medicaid. If someone doesn't qualify for Medicaid, we have a grant through the state of Illinois that we can help people come for free. Again, I can help you with that. So I can help that patient get into whatever facility. Usually that's going to be Carbondale or Caseyville because I know the ins and outs of where they can go. But it is great. It's a blessing that we get through the state. They can come for free for inpatient services for 30 days. And then again, we can help them get set up with that full continuum of care, that outpatient model. It's a lot of information about Gateway. It kind of seems overwhelming, but I'm definitely someone that can help guide the ship if you have somebody in need. Every site has the uniqueness of programming, but we are known for our inpatient model. I do want to touch on a new service that we just started, and it is, I would say new, it's newer. We have a full outpatient model, like I said, but we now surround that with our recovery home. I know other treatments call it a sober living. We have to call it a recovery home because it is literally a grant through the state that we get for free. So anyone that completes our 30-day treatment facility, and I say 30 days as in our inpatient model, they can apply to go live in our recovery home, whether that's in Carbondale, that's in Jacksonville, Illinois, or up in Chicago. And they can stay with us at our recovery home for an additional 60 days. They have to be in our outpatient model though. So they're going to get basically it's like an inpatient model for up to 100 days to give them the full wraparound services, all the support, the counseling, the living, the structure, support to outside meetings. It's a lot to talk about, but I say that with we do a great job with those patients. So anybody, even with commercial insurance, they can come and live in our recovery home, and they don't have to pay for the recovery home because it's literally free. But we will bill them like for their outpatient. So that's either partial hospitalization, which now they've changed that to high intensity. It is basically day treatment. So they're with us during the day. 9 to 12, 1 to 4, and then they break for breakfast, lunch, and dinner, and then they live in that recovery home living. Men and women now, we just opened up 5 beds for women in Jacksonville, which is super exciting. We do have 12 up in Chicago, but for down here in downstate, central and southern Illinois, women recovery home and Oxford homes, all they're very hard to find. So especially wrapped with a outpatient model. So that's a little segment about our outpatient and recovery home. And then I'm sure everyone knows we do offer virtual intensive outpatient for all those payer sectors as well. That is for anyone like me that lives out in the middle of nowhere and they have to drive into an outpatient and it's just not feasible. They don't have transportation. Those patients usually are recommended to start at outpatient when they leave our treatment facility and they don't go to our recovery home and they just want some support back home. It's up to 3 hours a day. Let me rephrase that. It is 3 hours a day, up to 5 days a week. And they can do that even hybrid. So if they want to come in and see people and have that more group setting and maybe meet with their individual therapist, they can do that either in Swansea or Carbondale or Springfield, but more likely they're going to be on virtual, especially if they're coming from today, Greenville. That's a little bit of a haul, especially if they're trying to get back to work or they are working. We do a lot of individuals that are professionals, say they go into a medical detox with us and they are like, I do not have the time to be anywhere for 30 days. we will support them with virtual services if that works for them. I know a lot of questions are, well, how do you keep up with, their drug testing, making sure that they are sober? Honestly, where we are today, it's just a blessing to have virtual since COVID. So like today, before COVID, I would have not had this. So it's better than nothing. And anybody motivated, and it does open their eyes, maybe it will build some trust for them to come in and get some services, whether it's Gateway or one of our other community partners. So the other new model that we offer is our Focus Mental Health. So it's very new, and I honestly am trying to get more comfortable talking about it because it's very new. So anyone that doesn't struggle with substance use disorder, so a lot of my family members that I work with, whether it's their spouse, their son, their daughter, or just a friend, we offer just primary mental health treatment. Anybody that has a diagnosis for depression, anxiety, stress, mood disorders, schizoaffective disorders, we can work with them at a telehealth level, which is basic outpatient. And that is a new model that Gateway offers. We have a contract with all the MCOs and Medicaid. We just hired someone in Swansea. So that is going to be up and running. It is up and running. Again, when it's virtual or telehealth, they can really pilot out of our Bloomington or Peoria office. But we are bringing that behavioral health center model, which I think is very important to just open up not just one lane that we've been doing. We are opening up a lot more services. I didn't talk about, I've always been known for adults. For the last 5 years, we used to take kiddos, but we can take 17-year-olds by case. So I've been working really closely with Rosecrans because they're our only adolescent treatment provider in the state that does inpatient. So we can take a 17-year-old for outpatient, virtually or in person. It is a case-by-case scenario. I've been very fortunate to help a few of those because that's a really hard age in between. And I think I'm going to break it there for questions because I could probably talk for a lot longer, but I know I want to be respectful of everybody's time. And again, just wanted to, remind everyone that the new services that we offer, we're not just a, treatment facility for just inpatient. We do a whole plethora of things, and we've been doing a great job clinically for 55 years. So thank you guys.
All right. So anybody got any questions? That was a lot of stuff. You have to have some questions.
I think that one thing I didn't mention, this is kind of personally, you can call or Google our phone number. I'm not going to disrespect Gateway's model that they have, but it is very, we have a huge need that we all help serve every day. A statistic that we did in October, we had 11,000 people call us in the month of October. We only have 500 beds in the state, and we are the largest provider. And everybody that is on here has some services that we offer. So it's so important to have a network of people. So Ross has been a great organization. But with that being said, the phone number that you need to call for Gateway is going to be my phone number because I know the ins and outs. If someone doesn't call me and they call the number, they're going to be looped through different departments, and they're going to be looped through what sites and what services. And sometimes they just don't get a phone call back, and then they get frustrated and they're, or we can't get a hold of them if we're calling them back. And again, I have people that I can't get a hold of, but I just want you to know my phone does ring a lot. I will be honest, I'll try to answer your questions. I'm going to let Tony have my contact information, but I will share that with you guys with our brochures so that you have my direct number. It's always good to have a direct phone number. That's all.
If nobody else is going to ask questions, you guys always know I have questions. So Carrie, if I have someone who reaches out to me and is struggling and is looking for some services, would you want me to give them your personal number, or would you prefer that I gave them a number to Gateway?
So I have a Gateway phone. So it is a Gateway number, and you are more than welcome to give the Gateway phone number. I have boundaries. I've done really well the last 6 months of doing better because I have an addiction to helping people and answering my phone. And I've got to do better on putting out boundaries. So I'm not going to answer the calls at 2 a.m. and I'm going to be respectful to get back with them the next day as soon as possible. But if I'm not working and I'm usually driving because I have 18 counties, I will answer a phone call and I will direct them to what the next step is because I am the middleman. I cannot do everything. We have a clinical team that has a series of questions that they have to ask. They have to do a phone assessment. It is a protocol. I cannot do that. It is reviewed by our medical and clinical staff. We do not accept people that are a threat to each other. We do not take someone that is an active suicidal ideation. So we weed out all those things. If someone's in the hospital, we have to get medical documentation. So yes, you can start with me and then I will help them get to the word.
I do believe that I think having a direct contact person is really important. Consuelo, you got a question?
Yeah, good morning. So I'm curious to know, what is your policy, I guess, for after hours? If there was someone that is trying to get assistance after hours, I know that you're saying that you're the first point of contact, which is great. But if there's any situation, if someone is at another agency, or if someone is not really familiar with Gateway and they're just contacting any kind of numbers, what is the process, I guess, for after hours? And secondly, do you all have anything that, like a referral or anything like that? Like if someone's at an agency like we are at Chestnut, is there a way or something that, we could send you like a quick referral? Like we know that this person needs services. We know they went through kind of the process either at Chestnut or at another, entity. Do you all have a referral?
Yeah, so that's a really good question. I am more than happy to help someone, but again, like I said, I'm the middleman. If it's coming a direct referral from another treatment provider, a community agency, we do not have to have a referral, but it is always best. So we work really closely with Chestnut internally. Our Paceyville staff does, even our Bloomington and Peoria, and so it's just having a contact person. So if someone calls after the hours, say it's 9 o'clock at night, and there's maybe been a family session, and the patient is ready to make the next step. Depending on, there's a lot of questions we ask, like if they've done their assessment. We usually don't do assessments in the middle of the night or in the evening. We take that the next day, business day. But I can help collect all the information to get that patient ready to be set up for an admission call the next day with our team. So yes, I can align the dots, but as far as who is that direct person, it is a whole team of people. Because at our Caseyville facility, they all work different hours. It's a smaller setting. There's only 42 beds. So I know when those people can be contacted, but you as in referral sources would not know who's on staff that day or who is answering the phones. And again, they answer phones all day too. Does that help? Do you have any other questions? I'm more than happy.
I'm really kind of speaking on if yesterday we were at an event, and I'm just asking because there were teens at this event and we had people in transition. And so I'm trying to find out if they're, like you said, your number, we will definitely give your number out. That's not a problem. I'm just trying to make sure that whoever, contacts you all, or whichever resource, that's available, people that are in transition, I think is my question, to make sure that they can, get the assistance and all of that. A couple of people had questions, like I said, people who were, I'm thinking about a mom yesterday with her child, who is having some difficulties. I'm just going to say that, 16 years old, and is in need of an assessment, definitely an assessment. And so just making sure that, and I gave them, several numbers who to contact, but just if we could have, like I said, it's a complicated situation. I'm not going to take too much of people's time, and I know other people have questions, but we can talk offline.
Yeah, I will let you know that the 2 documents that I'm sending, We just got this new document and it has all 16 locations, the address, the phone number, the fax number, and the email at each
Okay.
site.
Okay.
So that
Perfect.
is a great start. Again, if someone calls our 1-877 HOPE phone number,
Uh-huh.
they're
That's
going to
the one
be
number that we
rerouted
gave them.
down. But
Yeah.
as a referral source, I would love for you guys to call the sites directly if you're not calling me.
Okay. Sounds good. I don't know who that was waving, but I'm waving back.
Hi, Sarah. I was waving at Miss Lauren Davison.
Gotcha. All right. Thank you.
And then Lauren had a question.
Yeah. Hi, Carrie. It's good to see you.
Hi, Lauren.
So I was just wondering, where did you say the recovery homes were located again? What all
Yeah.
cities?
Yep. So we have Jacksonville, and then we have Carbondale, and we also have, I don't know Chicago, sorry. Let me give you Chicago Independence and Chicago Kedzie. So there's 2 locations up in the Chicagoland area.
Okay, gotcha.
Yep.
All right,
And if
that's
anyone
all I
ever
needed.
wants to come, yep. And if anyone ever wants to come see our sites, I highly recommend doing tour, to see it, meet our staff, look how the process works. You guys share your information or what treatment agency or community agency you're working for, and just kind of paints a better picture for everybody, knowing the ins and outs.
Lauren, do you have another question or is your hand still just up?
Oh, I'm sorry, my hand's just still up.
That's okay. That's okay. All I can see is the hand. I didn't want to miss anybody. Anybody here in person got any questions for Carrie?
Are there any in the shadow? Chat. You can.
You check the chat. Jessica has to hop on.
Yeah.
Do you guys have a website that tells you how many beds are available?
We do not. Unfortunately, we identify that we have a lot of things going on, but I would know the ins and outs of what beds available. Again, we have open beds more than people don't show up for their appointments, people leave. So I can definitely help you guys understand what the wait time looks like. And I always encourage somebody that is waiting, they need to call every day to check in, because that bed might come up the next day because somebody left or didn't show up. You know what I'm saying? So I know that Caseyville had 4 openings on Monday, and Springfield had a few openings as well for men.
Do you have disqualifying factors for incoming patients, such as sex offender, violent history, felonies, things like that?
Yes, we do. It's all case by case, but every site also is different. We do not have private rooms, so the sex offenders have to be again case by case. Most of them are usually sent to virtual, but there has been a few one-offs that we have been able to take. But they have been at our Carbondale location.
Okay.
So again, it's more case by case.
Any other?
Really, honestly, like we go through a whole thing with individually. We do not have that, I guess you'd call it red tape list anymore.
Right.
It is all case by case, but the most cases that I've seen are the violent crimes, violent behavior, and they're in a psych hospital and they have a lot of mental health and like suicidal ideations going on.
So one of the problems that I have faced outside of violent crime and sex offender is significant medical history.
Mm-hmm.
So heart conditions,
Yep.
cancer diagnosis, things like that. Is that still case by case?
It is. Those cases are, if someone is a wheelchair, that's really hard because it depends on what site they're going to. But again, we don't say no just because they're in a wheelchair. If they are, if they can't get up and shower and take care of themselves, their ADLs, that's one thing they usually have to say. You have to be, we don't have an aide to help you get out of bed, to help you get dressed. So very good question. But yeah, it usually is all still done case by case.
Anybody else have any questions?
I think there's one in the chat.
One in the chat. Okay. Do your recovery homes accept FOLX? Oh, wait. Folks. Things just keep popping up on my screen. I apologize. Do your recovery homes accept people who are receiving MAT treatment?
Yes. Depends case by case. I know methadone is a big one that we don't use it. It's the medical provider that we have on our staff. It is like nurses do this hand that out as well. They can't get a job when they're in the recovery home in the last 30 days.
Question, do your recovery homes, and I can't get to the end of it. Jen, can you tell us what your question is if you are available to? I can't get to the end of your question.
You actually just answered it. Thank you so much.
Okay, I thought it was about MAT or MAR treatment, but I wasn't positive. Jen asked the question. Anybody else got any questions?
I have a quick one.
Go ahead. Yes, Megan.
Carrie, if somebody is interested in like the outpatient model with the recovery home, does the admissions process look the same and that they call in and get the assessment and just indicate what they want, or is it different?
So if they're coming from another treatment provider, they have to have completed a residential model from somewhere else. It could be Chestnut, it could be your program. But there is an interview process that takes place with that individual. And then we decide if they are accepted to get in. But yes.
Perfect.
Did I answer your question?
I was wondering, since adolescence was brought up, and obviously we all know that that is a problem. Is there any chance that you guys will be doing adolescents in the future?
That is well above my pay grade.
Okay.
I would love to say yes, but I don't know.
It's just a niche that is very short here in Illinois. And having been there with an adolescent before, and there were options then, that I can't imagine now.
I know.
So thank you so much for sharing so much going on, so much knowledge, so much for all of us to know. And I always say that is our reason for being here, is so that we're not operating in silos, so that we're all working together. We can accomplish so much more together than individually. I do want to mention the Bond County Recovery Council is still working diligently on their anti-stigma campaign, and we call our anti-stigma campaign Beyond the Silence. If you haven't been to our YouTube channel, I highly recommend that you go there and see some of our people with lived experience who serve on our advisory board, who were willing to let me do interviews with them. And we are creating anti-stigma videos from those. And just so you know, we stole that from Elise and Montgomery, Macoupin County. They did a fabulous campaign, and we're like, hey, we want to try and do that. That's not as easy as it looks. I had never made a video before, so number one is kind of sad. If you watch it, just skip over it and watch number two, because I really am proud of number two. I made great advancements on number two. So go to our YouTube channel, the Bond County Recovery Council, and check out that second video. And you can watch the first one and laugh and be like, did a child do this? Okay. But it's still got good information on it. We created 5 different messages, and that was decided on by our advisory board or by our anti-stigma work group. We worked long and hard, and we keep those 5 messages as a flow through all of our things that we're doing. And the 5 messages are recovery rock, and then just stigma with a big X through it, recover out loud in Bond County, broken crayons still color, and you are not alone in Bond County. And we have yard signs made. We had 100 of them printed. We're down to about the last 15. If anybody within Bond County would like a sign for their yard, I think we still have a few of each of those sayings. We also have buttons that we made that have the same messaging on them. And then we have created table tents that go on tables in restaurants. We just got 200 more of those. So we're putting them out at gas stations and restaurants, and they have a QR code, and people can just scan that QR code and it takes them directly to our YouTube channel, where they can watch those anti-stigma videos. They can also find out what happens at a Bond County Recovery Council meeting, because I'm recording them now and uploading them, especially for those trainings that we have, because there are people who can't attend, but they can come back and watch that, and there's some really great stuff on there. We are also working on some other outreach materials right now, and if you are interested, our advisory board does a game night on the 3rd Saturday night of the month. And they, in April, which is the 3rd Saturday from 6 to 9, and it's normally at the senior center here in Greenville. And they're doing a really special project in April. We had a donation of some tie-dye kits. And so we've got some white t-shirts, and we're going to tie-dye t-shirts and then use the messaging, the anti-stigma messaging, and do iron-ons for the anti-stigma messaging on the tie-dyed shirts. And so it's going to be a lot of fun, a good night, and everyone is welcome there. It's a night of fun. We have kiddos, we have adults, and you are welcome to attend that. So those are just some of our anti-stigma things. We continue to serve at the community meal at the First Baptist Church here in Greenville. It is held on the 1st and the 3rd Wednesday of the month at 5:30. There is a little short message at the beginning, and then they serve a free meal. We have a lot of families who attend. We don't have a recovery community organization here in Bond County, but we are participating in things that look like RCO work. One of the things that the First Baptist Church does is those meals, and that's something an RCO would be doing. And so we wanted to get involved. So what we do is we attend the first Wednesday. Our advisory board meets immediately after that. So it works out really well. We all have dinner together, then we have advisory board. And then on the 3rd Wednesday, our advisory board volunteers to do the serving at the community meal. And it's really actually a good time. We sign people in, we do serve the food, and then we stay afterwards and we help do dishes. And it's a lot of dishes when you feed 100 people. You know, but we do dishes, we help vacuum, we help clean up, and that's kind of our way of giving back to that program and helping to support it, because it's something that has just been really valuable to the community. We also are still hosting our laundry days. That's the 1st Saturday of the month. I want to give a big shout out to Sarah and Sam and Clarence and Dusty and all the people who have stepped up to the plate since I started my new position. I have not done a game night, and I haven't done a laundry day. The people from the advisory board are so awesome, and they're stepping up and they're going out and they're doing those things. They had a really great turnout this last time. at our laundry day. So those will continue to be from 11 to 1 at the laundromat on Beaumont here in Greenville on the first Saturday. We encourage you to invite anybody out who could use some help. And I do want to say that we are not sticklers about, you have to do laundry between 11 and 1 and on that certain day. And if you aren't available to do that, then the Bond County Recovery Council is not going to help you. That is not how it works. We also have had individuals who were reaching out. We had someone a month or so ago who was getting ready to leave for treatment and didn't have any clean laundry. And we were able to meet them up there, give them quarters and laundry detergent, and help them get their laundry ready. We've helped people who serve on our advisory board when they were short on funds and needed to do some laundry. So it is something you can reach out or ask someone to reach out about if that's some way that we can help them. Nobody should have dirty clothes. We will help in any way that we can. Sarah has, from our advisory board, Sarah back there is so stinking incredible. She has created the Bond County Recovery Council app. We now have our own app. If you have not downloaded that, the QR code will be included when I send the minutes out. Download the app. Everything you need is there. She's got a calendar on there. It lists every single meeting. Everything that has to do with recovery in Bond County is on that calendar. There's a resource list for local and surrounding area resources, statewide, local, and then, surrounding counties. A wonderful resource list there. And they've done a lot of work on that, making sure that that's updated and current and the numbers are appropriate. How often that things are old numbers, and there's nothing worse when you need a resource than dialing numbers that are incorrect. And so I want to thank you for all the work that you've done on that. Please download the app.
Team effort.
Team effort. Yes, it has not just been Sarah. Sarah spearheaded it, but a lot of people have stepped up to the plate and helped with that. We do still have a few unhoused bags. The First Baptist Church has been kind enough to keep those, allow us to keep those there. And I think that our RCO development work group is going to be making more bags in the future. I'm not going to commit to it. I'm at a phase where I'm not making commitments for someone else to do since I won't be here any longer, but I'm guessing that they will probably do that. No promises, but we do have some bags left still at the church. And I think Sam still has some bags too. Sam has volunteered. She's got bags at her house and she's willing to take one any time of the day or night or get one to someone who needs it. They contain some hygiene products, some snacks, bottled water, and they are in a drawstring bag. And we also, and they have some gloves, socks, and some scarves in one of them, some hats. So this time of year, those things are greatly needed, I know. We do have 3 strategic planning work groups that follow our strategic plan. We meet, we have an RCO development work group, an equity and inclusion in rural communities group, and a stigma work group. If you are interested in any of those, please reach out because we are looking for people to serve on those groups. Elise, you got a question, dear?
Yeah, I was just curious. So we were doing laundry days for a little bit, but we were doing them weekly, which we learned our lesson really quickly because it can get really expensive, unfortunately. So I think we're going to move to monthly, but my question is how are you guys funding that? Like, what are your tricks to getting that funding?
We have tried several things in the past. And we are actually discussing, we're getting short on funds right now. And so we are looking to work with the faith-based community possibly. We were talking about, and this was one of our conversations at our last advisory board meeting. And we talked about creating some sort of bucket or something and having churches do like a quarter day where bring your quarters and fill the bucket, or even maybe possibly partnering with the school to fill the bucket with quarters. And then partnering with churches where they have a certain Sunday where they bring in Tide Pods, or not Tide Pods, but any pod, laundry pods, or dryer sheets. We do have a very good relationship. We've worked with the Ministerial Alliance and served there for quite some time. And so they are really helpful in anything that we've wanted to do. So that's our next funding stream that we're looking at. We also have partnered with Prairie Counseling Center from our health department, and they have helped support that very well. We also have somebody on our advisory board who's been talking to some businesses who are willing to. We have someone who committed $500. I don't have it yet, so I don't call that, it's not money in hand yet. And actually it doesn't go to me because I'm not here, and it doesn't go to our ROSC because we cannot fundraise. It goes to the people on our advisory board, have a treasurer, and they handle that money, any donations that come in, not the ROSC.
Thank you.
And then there are some general reminders. You will get those in the minutes. But I've got 6 minutes left at the end. And Nadine, I would love for you to take those 6 minutes and share about this new grant that you have, because I don't know anything about it and I want to hear about it. And I know everybody else does.
Perfect. Do you want me to, I have the floor now?
You go, girl. You go, girl.
Perfect. Okay. Sorry. Okay.
You're all right.
So this new grant that we had received, I'm with the Bond County Health Department. For those of you who don't know, my name's Nadine Rickoff, and we recently just received a grant called Community Anchor Network. So it's we're representing the Metro East IDPH region, and we recently received this grant to improve how the state of Illinois can strengthen systems within local communities. The goal of the program is to really strengthen those systems by improving service delivery, coordination among providers, and overall responsiveness of the system to youth and families. So as the community network anchor for the Metro East region, we are looking to convene with organizations and social programs who have established community networks. And we are not looking to really replace those networks. We would just like to be working alongside organizations that have already trusted relationship within their communities. So we would like to partner with youth, families, community organizations who experience these systems firsthand. Hearing people with lived experiences in family-run organizations is so important to us. So by hearing directly from those lived experiences, we can develop a more accurate understanding of the challenges and gaps within the system. So we, as the Community Network Anchor, also will be serving as several functions within this region. So let's see here. The hope is to create a two-way feedback loop between the communities in the state of Illinois to improve child and family mental health and wellness programming within the communities. So we're kind of going to be like that we're going to be that direct line to IDPH, because we want to hear from, so we're going to be serving, I think it's 17 counties. Yes, in the Metro East region we have. So I can gladly list those off or get those to any of you that feel like you would be interested in helping me out with this. I'd be more than happy to send you more information regarding it. I saw Mark on here and I was like, I definitely need to talk to Mark, it looks like, because I feel like he would be a great help with all this for me. And because I need to talk to somebody that's kind of overseeing, I guess, in a way. So with him being Metro East, I feel like he'll have some good connections, if that's possible. I don't know if he can hear me or not, but
he can.
He can. Okay, sounds good. Okay.
I could tell by his face.
Yeah. Okay, perfect. Okay. But yes, I know that was kind of a lot.
I've already connected her to.
It was a kind of a quick rundown of it, but yeah, it's really going to be a great thing whenever we get it started. We're in the very beginning of it, so it's very new, very up and coming, but we're very excited about it. And if anybody's got any questions for me, I can always put my email in the chat, phone number, or I can answer any questions right now. So.
Well, it sounds like you're in the right place, Nadine, because
yes, for sure.
That is my basic description of what a ROSC is. When you know, when somebody wants to know, I am like, it is bringing all the networks, all the players to the table. You know, and so like you said, programs who have networks, and yes, that's what we are, is all the social networks and all the pieces of the puzzle, you know, and far beyond just social work, you know, because recovery includes, you know, jobs and transportation and housing and healthcare and all of those pieces that fit into the puzzle. Recovery is not just using drugs. And so we do, looks like our work's going to overlap quite a bit. So I'm excited, Nadine. And if you would email me that list, I would love to see your list of counties to see if any of my counties in Region 4 are included in that.
Please, please.
They
Yes,
are.
I would gladly send those your way, Tony. Thank you.
Great, because I've got great connections in 13 different
That's
rosters.
when I always try to I either message you or Dusty. I'm like, one of you two. I'm like, I know would have great connections. So I really appreciate you guys for letting me talk on this. Thank you.
Thank you, Nadine. Does anybody else have any questions for Nadine? Crickets. All right. Well, my clock says 10:50. Oh, nope, it just turned over 11 o'clock. Meeting over. That is perfection. Much love, and I will see everybody around, but probably not next month, but maybe. We don't know for sure. So I love you all, and thanks for all that you do and all the great work. Bye-bye.
Hey, Tony, thank you for everything you do.
Thank you.
Did I send you this? Forward it to you. Hi, Lauren.
I don't know.
It's at all the counties at the bottom.